Hello friends, it is the 2nd or 3rd of August. It is Wednesday. Sorry, I'm very breathless. My name is Leslie and this is Leslie's Cancer Confessions. I had promised that today I would be uploading a video, the first part of a 3-part series talking about cancer diagnosis and living with cancer, and then planning for your exit, the end of cancer, your final days. But instead of doing that 3-part series today, I will be uploading that first section later this week. And today I'm just going to be giving you, check this out. My dogs wrecking each other while I'm filming this video sitting on my bed. Instead of doing my 3-part series today, I'm going to be giving you a little Cancer Confessions one-on-one talk about how I'm doing and what's been going on with me. Today I had my doctor's appointment with my oncologist. Normally I go every 4 weeks, but he had a vacation. And so here, I'm going to put you guys down here so my hand doesn't move so much. He had a vacation, so it's been 5 weeks since I've seen him. Hey, Sadie wants to say hi. Hello, people. Hi, hey. It's been 5 weeks since I've seen him, so today I went in to discuss how I've been doing the past 4 weeks, concerns that I have, that was Oscar, what my experience the past 3 months taking Xarelto has been, and to set up a couple of tests. Stop, you guys, stop. One test being an ultrasound of my upper arm to see if the blood clot that I had there has gone away, and if it has, then I can stop taking the Xarelto, which is a blood thinner. The other test being a CT PET scan, because it's been 3 months, and when you live with terminal cancer of any kind, they scan you every 3 to 6 months, and in my case every 3 months, because my cancer seems to continue and progress or stay the same. Not really. The past year it really hasn't gone into no evidence of disease. It's just consistently been there but not grown. So we discussed that. We discussed depression, which I've shared with you in the past. I've always suffered a little bit from being slightly anxious and have had to take anxiety medicine. But prolonged life living with metastatic breast cancer, or any cancer, I suppose anybody who lives long-term with cancer eventually will begin to feel the effects of the constant treatment, medications, side effects, things that happen to your body that change the way you look at yourself. And I'm sorry I'm looking off to the side. These dogs are wrestling. It's kind of distracting. So I'm going to go point through point, point by point over what we talked about today. We began talking about the Xarelto and setting up a test on the 29th of August for me to have the ultrasound of my vein, the vein mapping. And then we talked about depression and my feeling that I am not keeping my depression under control with my current dose of anti-anxiety medicine. I'm feeling quite anxious, nervous, sad. And of course, being sad is normal, and you should allow yourself to experience your feelings and feel them. But I feel that my sadness is out of control, and it is more on the extreme. It's depression. And so in order to control that, we've decided to increase my dose of medication. So then the next point is this part of my body, which in the past month has incredibly grown. I have gone from 150 pounds to 165 pounds in 4 weeks. That's a lot. That's 15 pounds in 4 weeks. Yeah, 15. And this is super uncomfortable. It's, it's obvious I feel pregnant. I mean, that's bad. That is bad. So I told him I was uncomfortable. I'm having trouble breathing. I'm having a lot of lung pressure and shortness of breath and discomfort in my own body. And of course, having a sudden amount of weight, obvious weight, makes you feel very unattractive and uncomfortable in your own body. Your clothing doesn't fit, and it's sudden. It's a sudden onslaught. It's not like I gradually have gained weight by eating poorly or not exercising. By the way, speaking of exercise, I've been playing Pokemon Go with my daughter and did a little bit with my son while I was in Texas, and I've been averaging about 10 kilometers, 10K a week, which I think is about 6 miles, and that's pretty good in hot weather. So I'm not sedentary and gaining weight when you are on a plant-based diet and you're very conscious of what you eat and how much you eat, portion control, and you're semi-active. I mean, I have cancer, so it's not like I'm out running marathons or, doing Ironman competitions, but I'm more active than the average person with what I have right now, and average being a key term. So at any rate, getting to the point, we talked about this, and it would appear, or it would seem, that the concern is that I have fluid in my abdomen. Now, you might say, wow, how'd that get there? And that was my question. Well, I have cancer. So it's probably cancer cells in my peritoneum sac. I don't know if that's the correct medical term, but my abdominal cavity. So where could it have come from? Maybe from my lung metastasis, or just cancer cells spreading. So I will be going in addition to getting the vein mapping on the 29th, I will be having a CT scan from my pelvis on up, because the cancer's in my hip bones on up, just to see what's going on there. Now, how do they treat that? They treat that with what's called a paracentisis, which is very similar to what I had in my lungs, which is a thoracentesis, because the lungs are thoracic and the abdominal is peritoneal. So it's a paracentesis, basically meaning that they stick a needle in there, they tap the abdominal cavity, they inject through that needle tubing, and then they take that tubing and they put it into a suction sealed bottle that creates a vacuum and pulls the fluid out. Now, my understanding, based on my research and what the doctor and I talked about today, is the most often done with this is that they leave like a catheter in, so that if you redevelop more fluid, you can drain it on your own at home or on your planned doctor visits have it done for you. I don't know if that's what's going to happen. I don't know if that's what is going on or if that's the cause of this sudden huge spare tire. But I do know I'm uncomfortable and I'm having a lot of shortness of breath, and I'm not happy feeling so heavy and overweight. So we talked about that. He did feel that the lumps under my arms are, not shrinking. However, my tumor markers have gone down just by 1 point on each of them. My white blood cell count is low, but since I just finished chemo, he didn't want to give me a shot to increase my white blood cell count. Oh, excuse me, I'm having trouble breathing. So that's it. That is the update with me, how I'm feeling and what's been going on. And I'm sorry that this video's so short, but I'm having a hard time talking and breathing. So I will end that here this week, and I thank you very much for stopping by. Please take a moment to hit the thumbs up and follow, like, or subscribe. Thank you for stopping by and for written content about what's going on in my life. Go to lesliescancerconfessions.com and check back in a few days for part 1 of the 3-part series, Cancer Beginning, Middle, and End. And I will see you then. Bye.